Good morning, everyone. On behalf of BabyChakra, I welcome you to our live today. And our topic for today is managing PCOS right from the start. I'm Manisha Pradhan, editor with BabyChakra Parenting Pod. Before we begin, I would like to also welcome my experts for the day today. We have with us, I think we've just lost Dr. Manisha will join us back. Yeah, so we have with us Dr. Premi Manjushri, and we have mom and clinical nutritionist Rachel Deepthi, and we have Dr. Manisha Singh with us. So please excuse us because Dr. Manisha is in a low network area, so you might see her, network going off and on. So just bear with us. So before we begin, I would like to tell you a little about BabyChakra. BabyChakra is a platform for parents to connect with experts and other parents to make better parenting decisions. And BabyChakra is also the most India's most loved and trusted online store for babies. Okay, let me introduce you to our panelists for today. We have with us Dr. Manjushri and Dr. Manisha. Both of them are gynecologists and obstetricians. And we have with us Rachel Deepthi, who's a clinical nutritionist. So we begin with our questions now. Dr. Manjushri, would you like to introduce yourself first, please?
Yeah, I'm Dr. Manjushri, working as an obstetrician and gynecologist and also a laparoscopic surgeon and a cosmetic gynecologist working at Anumai Baby Hospital, Vijayawada, Andhra Pradesh.
All right.
So thanks
Dr.
for giving me this opportunity from my baby So it's pleasure to be here in this platform talking on
Thank you for being a
PCOS.
part of this discussion. We have Dr. Manisha Singh. Would you like to please introduce yourself?
Yeah, hi everyone, and I hope you guys are having wonderful day. And this session is all about managing PCOS right from the start. So I'm Dr. Manisha Singh, and I hail from Varanasi. I'm an MD obstetrician and gynecologist, also fertility specialist, laparoscopic surgeon, and a sonologist. So as a cases, we come across almost every day. Out of 20 OPDs, we see almost 10 patients with or without managing, or both adolescent young children, managing with the irregular period, and it's quite befitting for the mothers. So I hope Baby Chakra is going to help with this particular session to all of you people out there and solve the queries that have already been displayed, and any issues that you everybody will be having. Over to you,
Thank you.
Ayushi.
Thank you. Dr. Rachel, would you like to say something about yourself? Sorry, Rachel, would you like to say something about yourself?
Yeah, hello. Good morning to all. I'm Rachel Deepthi. I'm from Chennai. I am a clinical nutritionist as well as specialized in lifestyle, sports, maternal and child health nutrition. So that's the major area where I work with children as well as pregnant moms. So today's topic is a very close topic for me, managing PCOS right from the start. So I help a lot of mothers who are planning for pregnancy as well as helping them throughout their pregnancy to have a positive experience as well. And my clinic is in Nungambakam, Chennai, Hyundai Medical Center. Happy to join with you all today for this exclusive session.
Thank you. So let's begin with the questions now. I would like to ask Dr. Manjushri, what is PCOS and what is the cause of PCOS?
Yeah, PCOS, it is nothing but polycystic ovarian syndrome or a polycystic ovarian disease. Both are nothing but the same. So people keep getting confusion what is PCOS or what is PCOD. So both are nothing but the same. It's nothing but a syndrome. We call it as a syndrome because it consists of a 2 to 3 components, whether to say that patient has a PCOS. So we include if the patient has irregular periods, that is irregular, whether prolonged or it can be infrequent or prolonged flow. Then coming to the excess of androgens, that's a male hormone. But if it is present in the woman in excess and they present with a excessive hair growth, in unwanted areas like upper lip, chin, chest, and abdomen. That we call it as hirsutism. So, and the next component is the in the ultrasound feature. If there is polycystic ovaries, multiple follicles surrounding around the ovaries, that is, we call it as peripheral pattern. If they are placed in the peripheries, so that we call it as polycystic ovaries in ultrasound. If any of these 2 to 3 features, at least 2 features are present in a patient, then we term them as polycystic ovaries the patient has. So the most common cause for this polycystic ovarian syndrome is the insulin resistance. So
Right.
insulin is a hormone that the pancreas makes. That's an organ in our body, pancreas. So it
Yeah.
allows cells to use sugar, your body's primary energy supply. That is, if cells become resistant to the action of insulin, then blood sugar levels can rise up. So that is when we call it as insulin resistance. And the next is the heredity. Mostly it is genetic. It could be genetic. So if the mother has PCOD or she's obese, it can run in the families. And the other component is the excess androgen, as I have told you now. So with PCOS, the ovaries will produce high level of androgen. So having too much of androgen in the body will interfere with ovulation. So this means that eggs don't develop on a regular basis, or they aren't getting released when they have to get released. So excess androgen can also result in this hirsutism or unwanted hair. And other symptom we see is the acne or pimples.
Hmm.
So these are the main causes of PCOD.
Okay. So, Dr. Monisha, moving on to you. What are the symptoms? What are the symptoms of PCOS? Dr. Monisha, can you hear me? Dr. Monisha, am I audible?
Ayushi, I'm having a lot of issues with the network. I hope I understood the question. What the question was, what the varied
What are the
symptoms
symptoms?
were,
What
is
are the
it?
symptoms of PCOS? Yes. This is Manisha here, Dr. Manisha here. Okay.
I really can't hear.
I think
So
Dr.
I'll let
Dr. Manjushri, how about you answer the question for
Yes, I can do it.
what are the symptoms? Because I think she's in a very low network
Yeah, yeah, I can do
arena.
it.
So yeah, what are the symptoms for PCOS? If you could explain that to our
The
viewers.
symptoms of PCOD will start at the age of menarche, at their first menstrual period, or sometimes they may develop later after you had few periods, and then they can develop. So most common symptoms are irregular periods, or missed periods, or infrequent or prolonged flow. And other symptoms include acne, as I have told now, and excess hair over the chin, chest, and upper abdomen, and patches of dark skin, especially over the folds of the neck, armpit, and groin. This we call it as acanthosis nigricans. And other most common symptom they encounter is a weight gain or obesity. About 80% of women with PCOS are overweight or have obesity, and they have a lot of trouble losing weight. So the other symptoms are mood changes and all this. So usually, uh, and they also have thinning of hair, or they may have loose patches of hair on their heads, or start to go bald very early. And as I have told now, they have cysts, that is follicles, multiple follicles in the ultrasound. And the other most common symptom is infertility. So PCOS is the most common cause of infertility. That is, they are not able to conceive or get pregnant. So decreased frequency or ovulation can result in not being able to conceive. Sometimes many people don't even realize they have the condition until they have trouble getting pregnancy, or are gaining weight and they have difficulty in losing weight for unknown reasons.
Right.
So these are
Thank
the most common symptoms we usually see.
Thank you. So Rachel, would you give any kind of guidelines for women with PCOS? Since you're a nutritionist, are there any kind of guidelines for them?
that question. So, when it comes to managing PCOS, so first aspect that we always encourage the mothers or someone who's planning for pregnancy
Yes.
to take care of the six pillars of lifestyle nutrition or lifestyle medicine. So,
Hmm.
that includes a healthy diet that they have to follow, which has to be customized according to their health issues. So some, they have the basic symptoms of PCOS. They may be in the insulin resistant stage, or some would have become even diabetic at a very younger age. So all the symptoms and all their lifestyle conditions we get together, and we have to plan a customized diet, so which is very suitable for them. Along with that, the type of physical activity they do counts a lot. So that helps in weight loss as well as reduction of body fat percentage in the body.
Okay.
So um, uh, developing a good overall support for their health as well. So if there is any condition of high cholesterol levels and their bloodstream, so even that without any medication will be helpful for mothers to control them, particularly women to control them. So physical activity is a must. And when it comes to physical activity, they have to be very cautious about uh, the frequency, how often they do, what type of exercise they do, and is it with a personal trainer, or if that's type is suiting them or not, and the timing also. So many of them they just go for 30 minutes of walk, and that will not be suitable for them, maybe for their body type or the energy expenditure is low. So the timing also matters. So it is advisable for them to take up a fitness coach or a sports physiotherapist or someone who helps them in their workout, and who helps in achieving the target weight loss which they have calculated. And the third aspect is sleep. So sleep, most of them they get disturbed sleep. So setting their sleep timings based according to the circadian rhythm is very very important. So maximum of them whoever come to me, when they fix their sleep timings and the sleep quality, when it gets improved, half the war is already won over there. 80% of the health is already recovered. The
Correct.
medications come down, they see good results. So sleep is very important. And stress management. So it can be even peer pressure, or it can be a student studying in a college, or it can be someone who's working, or family pressure also to conceive fast. So channelizing their emotion is very important. It can be anxiety, depression, or ADHD, or any type of emotion that they are facing. It can be even OCD for some. So they have
Right.
to work closely with a psychologist. They should be open, to going to a psychologist, sit with them, get analyzed, and channelize their emotions. So that also helps a lot. And also, at the current trend, most of them have the habit of smoking and alcoholing. So any substance abuse, reduction of that, even stopping of that will definitely help them to have a positive birth experience as well as conceive as quickly as possible. So maybe for some it may take 6 to 8 months, but within 2 to 3 months naturally they can conceive. So all of this will really help them to get a positive effect when they it along with the doctor's prescribed treatment, along with a positive social connection. Also, the people around them, the relationship that they build with people, also counts a lot. So these are the first stage of lifestyle principle that they have to start
All right.
making changes before they get into a diet.
Thank you so much. Dr. Monisha, is your network better now? Can you hear me? Dr. Monisha, can you hear me? Okay, I guess she can't hear me. Dr. Manjushri, so I would pass on that question to you. What is the treatment for PCOS?
So treatment for PCOS is mainly focused on managing the symptoms or the things the patient is concerned about. And specific treatment it involves is lifestyle changes, and the next option is the medications. So in lifestyle management includes in overweight women the symptoms and overall risk of developing long-term health problems from PCOS can generally be improved by losing excess weight. So weight loss of just 5% can lead to a significant improvement, and they can get back their regular periods, and all their symptoms start getting back once they lose at least a 5% of their weight. And this overweight can be calculated by body mass index. So next is the body mass index normal is between 18.5 to 24. So they need to see to it that they maintain a normal BMI, and they can lose weight by exercising regularly, and as Deepthi has told, eating a healthy and balanced diet. So the diet should include plenty of fruits and vegetables, at least 5 portions a day, whole foods such as whole meal bread, cereals and brown rice, or eat meats, fish and chicken. And then next, coming to the medications. So the number of medications are available to treat this PCOD. First, it's symptomatic. If they have irregular or absent periods, so we need to see to it that they should get their periods regularly, either by giving them a contraceptive pills, or if they are willing to conceive or they are interested to get pregnant. So that will depend on the patient's symptoms or their requirements. Contraceptive pills may be recommended to induce regular periods, or maybe or using an intermittent course of progesterones also, that's possible. So other hormonal methods of contraception such as intrauterine system, that is intrauterine device, can also be placed for them. And if they are more into fertility issues, if they have infertility issues, so they can get pregnant. Many people ask, I have PCOD, whether can I get pregnant? I don't get pregnant. So all this, it's nothing like they don't get pregnant. There are medications, and we need to see that they get ovulated. So ovulation is the main concern in PCOS, because they are not ovulating. That is the problem. They are not conceiving. So we need to see that they ovulate. So we give maybe medications in the beginning to see that they ovulate. And if they are not conceived with that, maybe we need to increase the doses, or maybe at the last resort, they require IVF treatments. Your voice is not audible, Manisha madam.
Sorry. My next, you've answered both the questions for me.
Yes,
actually.
yes. Please
My
ask.
next no, I'm talking to me now. Dr.
I hope
Manisha,
you are able to hear me. So I believe the question was, is it a possibility to get pregnant in PCOS, right?
yes.
So accordingly, PCOS is not like a death sentence to any adolescent girl, or a reproductive age group for anybody for that matter. So it just gives you a chance to how much they can treat, and how much they can optimize their health, and then they can get pregnant accordingly. So definitely people with PCOS, struck with PCOS, can easily get pregnant. And if they need a little bit of push, that's what fertility specialists are for. Another question I think was, what is the treatment for the PCOS? Am I right? So
Dr.
PCOS
Manisha,
treatment, let me,
Dr. Manisha, sorry to interrupt you there.
yeah,
I
is it
think
okay?
we've
So
actually Dr. Manjushri's already
I
answered
think
that
ma'am has
question.
already discussed this question, the
Yes, yes,
treatment for the PCOS, right?
correct, yes. That has already been discussed because your network was bad.
Yes, please ask me. Yeah.
Yeah, so the next question is for Rachel. Rachel, what is the kind of diet that someone with PCOS should follow? Can you give us like a diet plan or
Yes,
a diet?
yeah, thank you, Manisha. So, any individual who has PCOS or PCOD, there are stages of diet that they have to follow. So, only with the help of an expert who has worked with PCOS will be able to give them the right diet for them. So, to be honest, there is no like a specific PCOS diet. So a more of balanced diet based on their health goals, it has to be altered. So taking in count of their all the blood parameters that they have taken, it could be their thyroid profile or their lipid profile or their CBC value, their iron profile, okay, as well as the blood sugar profile also. So putting all together as well as with their anthropometric parameters, their height and weight and the BMI, uh, a suitable diet will be given to them. So here, what we mainly see is they should include good amount of good fats. Okay, so that comes from any fatty fish. Okay, if it is a non-vegetarian, they can take that, and eggs they can take, and from vegetarian sources like you have nuts like almonds, walnuts, and the other form of seeds also you have pumpkin seeds, chia seeds, flax seeds. So taking them every day into their diet based on their stipulated goal, as well as the amount of energy that is being calculated for them, they can include into their diet. So the weight also includes, as well as the good source of fat is also being included into the diet. So the first nutrient which is important for PCOS is good fats. So maximum 90% of women's diet, they don't have good fats. Second is good amount of fiber. Okay, so that mainly helps in digestion, absorption of food, as well as keeping our GI system intact in place, pre and probiotics to grow. So maximum nourishment happens over there. So they have to include colorful fruits and vegetables. So that highlights mainly non-starchy vegetables. Okay, so they have to avoid all the root vegetables and starchy vegetables which has low amount of fiber.
Yeah.
Okay, so and that is the second, and the third is to get lot of vitamins and minerals which is suitable for the body. So that is the fruits. So minimum they should take variety of two fruits in a day, where they get natural source of vitamin C
Vitamin.
and other fat soluble and water soluble vitamins and minerals coming through that. So they need not rely on any external multivitamin supplement. So whatever your body needs, you get it from the food itself, like a natural source. So imparting that is very important. And the fourth nutrient is protein. So we have learned in our school, right? Protein is called as the bodybuilding food. So
Yes.
building all the dead cells and all the tissues in your body for all that wear and tear that is happening in your body, you need good amount of protein. We all know that Indian's diet is deficit of protein. So at least maintaining the ideal grams of protein with the help of a dietitian for a minimum of 1 gram per kg per body weight will definitely help them to reduce weight, as well as nourish them also. Their skin texture will become better, and the main symptom that we see in PCOS patient is acanthosis, right? So without any treatment, that discoloration will slowly fade out. So these are the positive outcomes that we see in our OPD over here. So
Thank
these are the four key nutrients that they have to be very much careful on, and magnesium and calcium. So iron. So any sources they can get from.
Yeah.
So that's always can be included into their diet.
Okay. Dr.
We
Monisha.
should definitely suggest, Manisha, that we have to, make sure the BMI is correct. See,
All right.
as we have already discussed, there is a lean PCOS also. So we need to make sure that the good diet and good fibers and good antioxidants are available. The
Hmm.
micronutrients and antioxidants play like a real key role in all these areas. We also
Okay.
need to optimize the things that she is coming from, the disease that she is coming from. So we have to complement that issue also. So I
Okay.
think how Rachel has said is was perfectly fine and absolutely brilliantly she has discussed. But we do need to understand the micronutrients, the myoinositols, and omega acids and vitamin D supplementations also play a good key role in all
Right.
these things.
Thank you. That was very informative. So, Dr. Manisha, since your network is better now, what is the main cause of having PCOS? What is the main factor that causes PCOS? We've discussed this before, but if you could just tell us a little more. Dr. Manisha, can you hear me?
So, what are the main causes of having PCOS? That's a legendary, like yet to discover situation, because
Yes.
it has shown it's not just phenotypically or environmental based, but it has been searched according to many hypotheses placed that it is genetically also involved. So we need to understand that the causes of having PCOS, you cannot just label a person, at that particular reproductive age group or whenever that she has come. We have to go back down to her embryological development also, as the consultants would here know about the Barker's hypothesis. It actually says that the female, the fetus inside the womb, when the mother is pregnant with her, the key role starts from there itself. Whatever the food the mother is taking, it helps a lot in picturing what kind of metabolic diseases, that women, that young child will undergo. Also, if the pediatricians could also suggest, and they have seen also, what mothers do or what the relatives do is overfeed a child. They're like,
Right.
keep
Yeah.
keep yourself healthy and everything. But you need to realize, if the kid at that particular child, there are many babies out there who are born with less than 2.5 kgs or less than the appropriate weight, right? So you need not force them with all the food in one go, ki chalo,
Correct.
to catch up the weight according to the this thing. Because what happens is, the organs that are developed inside the uterus, they are now adjusted at that particular release of hormones. And
Correct.
if you are overfeeding the child, that particular food starts depositing, and that
Correct.
is causing many metabolic diseases, including PCOS. So
Correct.
we also need to understand, if I'm talking about the genotype, definitely not forgetting the phenotypes, the environmental toxins that are known as endocrinal disruptors. Now, you need to be very informed about these things, that it is not just causing, there are certain chemicals, non-stick pans, and there are shampoos and many other conditioners or lipstick for that matter that we are applying, and we are not knowing that. Baby ko we put on kajal and everything, right? So we just don't know what we are applying, and day to day basis, the toys, the plastic toys that the baby is touching and playing with it, all these transdermal absorptions do cause the xenoestrogens to replace the good hormones. And this is one of the factors that is causing PCOS and many other diseases later on. So why not start there itself, right? So
Correct.
these are
So,
many of the key factors. Of course, relatives. If you have PCOS in your relatives, there are good factors that you may have one. So get yourself checked out.
that's wonderful information. And also, like you said, it's high time that mothers and women or anybody started switching to more natural products. I think more organic and more natural products and they should read the labels before they buy any product for themselves or for their children. I think that also will help a lot. What do you say, doctor? Okay, so I think we have just enough time to take a question from the audience. Someone here has asked, how can one manage PCOS during pregnancy? Dr. Manjushri, would you like to take that question?
Yeah. Pregnant women with PCOS who have conceived are more likely to develop a few complications at different stages of their pregnancies. In the early weeks, they include abortions or miscarriages. So they should be very cautious, and they should be knowing this complication and at least avoid what can be done by asking their doctor. and the other is preeclampsia. That means a pregnancy-induced hypertension in pregnancy. So they should, if there is a strong family history, they should be knowing that they might get hypertension in their pregnancy, maybe during the 6th month or in the second or third trimesters. And by taking a proper diet and avoiding restriction or taking these measures, maybe they can prevent this. And sometimes they can land up in a preterm birth, meaning birthing at a early weeks before entering into their 9th month. So they have these complications, and they should consult their gynecologist and take proper measures to prevent all these complications.
Thank you so much. Thank you, Rachel. Thank you, Dr. Manjushri. Thank you, Dr.
This is
Manisha.
Manisha. Yes.
Sorry.
If I may, can I add on a point to what
Yes,
Dr.
yes, sure, yes, yes, sure. Please go ahead.
Yes, so in my clinic experience, so yes, mothers who have pregnant moms who have PCOS during their pregnancy, the right way to control is to have a proper diet and exercise, not even exercise, a proper diet from the first month of pregnancy itself. So I have helped many mothers to control their blood sugar levels, not even, keeping them throughout their 9 months or 10 months during in the normal range itself, and keeping check on their blood sugar blood pressure values, also the thyroid values throughout. So all of them who had been worried about all these complications coming in, and who had history of abortions also, there were no sign of any of these symptoms. And eventually, the birth experience was so good for them. All of them had normal deliveries. Only one of few cases they had to go for C-section. So the importance of diet definitely has to be,
Yes.
advised by the doctor right from the first month itself. That's the place, where we can catch them at the early stage, so that they avoid all these complications in the later stages of their pregnancy. And even twin mothers, they do wonderful job when they come to me. They start right from the first month, and throughout the 9 months of pregnancy they avoid all these complications
Yes.
with the PCOS. Who is pregnant with twin moms, they can avoid all these complications with a very perfect diet, particularly with the help of a experienced dietitian.
Thank you so much. Thank you so much, everyone, for joining us today. And I would like to say a big round of thank you to all our panelists here today for all the insightful, information that you gave us. Okay, just before we leave, there is one question from one of our audience. So, does PCOS affect more than just fertility? Dr. Monisha, would you like to take that?
Brilliant question, Manisha. I think the patient are the women out there are very educated. They're enough to ask these questions. So, as a consultant, I'm not just saying as an obstetrician ourselves or as a gynecologist ourselves, but any women out there who is struck with PCOS and they visit any physician, any endocrinologist, this is their rule. We have to counsel the women out there. It's not just that they will be struck with PCOS and what complication that they may later on, just affect the fertility is one of the things. It may also cause abnormal uterine bleeding. I'm just talking about reproductive age, right? Reproductive system right now. So abnormal uterine bleeding, endometrial hyperplasia. There may be, in a rare chances, a cancer or tumor to the uterus itself or the ovaries. So it's not just that. Premature ovarian failures are one of those factors, but we need to understand that there are systemic disease as it's a metabolic state. So what happens is there are a lot of cardiovascular complications as well. We need to understand that the whole body is getting affected. If there is a hormonal displacement, if there is a deficiency or there's a disbalance between them, the hormone is an endocrine organ, the estrogen, the progesterone. So it affects the whole body as such. There will be thinning of the hair, as we already know. The dermatologists are, looking after. There are mental health issues that happens along with it. dietary problems, there are constipation, it's called irritable bowel syndrome. The constipation and diarrhea comes in a alternate bowel habits are like similar. And in a, if we do not check right now, or if we do not optimize with a good nutrition, with a good lifestyle, there are good chances that this becomes permanent, or the other metabolic diseases may come earlier than what is required as a particular timeline. So we need to start counseling the patients that, this is the right time that you start managing everything on your own. And we will tell you what other things can it lead to and what other things checked out. So definitely, this is a beautiful question, and it does affect more than just fertility. Yeah.
Thank you so much, Dr. Manisha. That was really, really informative. So on that note, I think I would like to thank everybody for being here and watching our live today, and also thank you to our panelists. Please download the BabyChakra app for more interesting updates for you and your little ones. Thank you so much. Thank you.
Thank you so much, Manisha. Thank you so much, BabyChakra, and everyone out there. And thank you so much, consultants, Rachel and Manjushri. So it was a brilliant meeting with you all.
Same here.